Welcome. My name is Brad Siff. I'm the founder and president of BioWave. Welcome to our 16th webinar. I'd like to introduce you to our guest lecturer this week. Her name is Deb Wells. She is the CEO of the Wells Health Group, and the presentation is on the BioWavePENS Reimbursement Guide. At the end of our lecture, we will have a Q&A session. There is a Q&A button at the bottom of your screen where you can submit your questions, and we will answer those questions live. So we're excited to have Deb here this week, and with that, I'd like to introduce you to Deb Wells.
Good afternoon, everyone, and welcome to the BioWave Reimbursement Guide for the BioWavePENS. I'm Deb Wells, and I'm the CEO of the Wells Health Group. Little bit of background. Our company is based in Washington, D.C., and we're a healthcare policy consulting firm. We've been here a little over 10 years, and we work with companies like BioWave who have this fabulous innovation that needs to be introduced to patients, and we help work with reimbursement and market access policies. We're going to talk today about the reimbursement guide for the BioWavePENS. And the code we are using is code 64999. Now, don't be afraid of that code. I know that it is detailed in submitting claims, but there are modalities that can be used that will help us with the coverage criteria. We'll talk about the payment methodologies, and we'll talk about what to do when you receive denials and have appeals. So the coding. So the AMA has given very specific guidance for the BioWavePENS. They have advised us to use code 64999. It is an unlisted miscellaneous procedure of the nervous system. And the AMA has defined PENS, of course, as the percutaneous electrical stimulation of a peripheral nerve using needles or electrodes. So again, do not hesitate to use 64999. Additional information regarding the code is that code 64999 is primarily targeted to personal injury and workers' compensation payers. And this code is inclusive of all the components performed in the application of the device. So that includes the physician's time, the device, and the electrodes. So that would be the placement, that would be the documentation, that would be the patient evaluation, everything that is involved with making sure that the patient is comfortable with the device, and again, all of the documentation that we are going to discuss going forward. It's all inclusive in our code 64999. So the other information that is important regarding coding would be the DRG code, and the most common conditions that we see with the BioWavePENS, primarily for chronic pain, acute, postoperative pain, and location of pain, particularly in injuries, would be low back or knee, shoulders, whiplash, migraine or concussion, and TBI. And BioWave has protocols for these very specific situations, which you should ask your BioWave rep to share with you so that you'll have that specific information. So some additional resources that might be helpful for you when you are doing your appeals are the BioWavePENS treatment protocols. And these protocols go into great detail about supporting verbiage that will be helpful in documenting the treatment plan and even potentially the protocol that you are using with this individual patient and why it might be unique. And the additional information that you are going to include with this supplemental verbiage is the location of the pain. Specifically, where did you place the electrodes and what was the reason for that location? What type of pain is the patient experiencing? Typically, the protocol is for 6 30-minute treatments. However, that may vary based on the patient's response to the therapy. So you want to document whether you are using 6 treatment protocols, or 7 or 4, whatever is working for that individual patient, you want to make sure that that is documented in the chart. Body positioning during treatment. How is the patient placed while the electrodes and the device are working? Is the patient supine, etc.? And what is the intensity range of the device that the patient is able to tolerate? How far are you able to increase the intensity without the patient being uncomfortable? And what motion during treatment did the patient have? Was there range of motion, in example, the shoulder, if that's where the pain is being experienced? All this additional supporting verbiage will be helpful for you in explaining the reason for the appeal if your claim is denied and you need to go through that process. Additional supplemental resources which may be helpful to you are the BioWavePENS clinical studies. These studies indicate the scientific evidence showing the effectiveness of BioWavePENS, and individual studies show the effectiveness of pens for knee replacements, as an example, and there are studies that compare the BioWavePENS to TENS. So again, depending on the reason for the denial and the reason you are appealing, select the appropriate clinical study that provides the scientific evidence supporting the specific situation you are working with. Additionally, the payer may ask you about BioWave and the FDA, and you may indicate that the BioWavePENS is a Class 2 FDA device, July 9th, 2006, and that FDA documentation is available should you need to provide that to the payer. What documentation is required for coverage? Always submit the supporting documentation, and we're going to show you a few examples of these specifics in the next few slides. And be sure these details are documented. What we need is the definition of the procedure or the product. So you're going to go into detail about the BioWavePENS. You're going to talk about what other therapies the patient has tried and failed, such as TENS or other pain modalities. You're going to talk about the nature and the extent and the need for the procedure or the service. Does the patient have chronic pain? How long have they had chronic pain? Is this due to an accident or an illness? And what time and effort and equipment is needed for this service or procedure? And of course, that's the BioWavePENS and the needle array that you are using in treating the patient. All of this is required to support the medical necessity. So this is a sample of the TENS treatment report. And I'm going to zoom in here and show you some of the specific language in a minute. But we do want to make sure you know that you have access to this document at the end of the presentation so you can see in detail and use this language. So I'm going to zoom out here and I'm going to show you exactly how specific the language is in terms of taking the patient into the treatment room, identifying 2 areas of maximal tenderness. And that's where you're going to indicate the area of the electrode placement. You're going to mark these areas with a pen or a marker. You are then going to clean the area with an alcohol swab and allow it to dry. So we're going through, as you can see, the instructions for administration of the BioWavePENS in detail. This is the detail that you will need to document in the patient's chart to submit with the claim for reimbursement. I'm going to zoom back out and we're going to continue here. So in this next slide, again, I'm going to zoom out. You see this slide, this document all the time. You recognize this as the standard for pre-treatment and post-treatment pain scores from our standard scale of 0 to 10. Same with stiffness, 0 to 10. range of motion, the degrees, any drug consumption, and you're going to mark the electrode location as you see on the diagrams of the patient, indicating where you place the electrodes. If it's for upper body in the shoulder area or in the lower lumbar area, and you're going to indicate a description of the patient's pain in this box. Is it stabbing? Is it burning? Is it constant? You know the words to use. These are the details that are needed in order to provide the appropriate documentation we need for reimbursement. Another document we're going to show you, this is the letter of medical necessity, and I'm going to show you some of the key words that are going to be required in this letter of medical necessity that go along with this standard documentation. We want to say that the patient is experiencing some relief from TENS. However, the pain continues to interfere with the functional capacity, activities of daily living, and overall well-being. And so due to the patient's condition and the inadequate response to TENS, the BioWavePENS treatments are required to decrease the pain, reduce opioid consumption, and accelerate the return to function. Again, we'll make sure that you have this document to use as you are writing up the documentation in each individual patient's file. Second part of the letter of medical necessity that we're going to show you here is just another example of the verbiage and the language that is required for documentation in the patient's chart. Here we go. The patient is experiencing inadequate relief from TENS and is currently participating in an evidence-based home care exercise program. So whatever specific modalities are going on with this individual patient, and again, you'll see that this is standard language as you're treating patients with the BioWavePENS. So you're going to have standard phrases that you use for each and every patient. So let's talk about supervision. We know that the supervision definitions that we are working under for the BioWavePENS in most of your offices follow under the direct supervision. The direct supervision in the office setting means that the physician must be present in the office suite and immediately available to furnish assistance and direction throughout the performance of the procedure. It does not mean the physician must be present in the room when the procedure is performed. So who are those practitioners that are going to be working with the patient and applying the BioWavePENS? So these non-physician practitioners are the PAs, the CNSs, the clinical nurse specialists, nurse practitioners, PTs, OTs, and as well as the chiropractors, if they are working with you in your staff. They are going to be working under direct supervision. And we also want to point out that state-by-state laws may dictate what certifications are allowed and required for each of these individual practitioners. So again, make sure that your certifications for all of your clinical staff are up to date. That will potentially be a problem should there be an audit, or if any of the investigative agencies come and take a look. You do want to make sure that you have all of your folks' standards and dates in place. Supervision requirements. So we're fortunate that in November of 2022, just this last fall, the government released provisions extending the public health emergency for the COVID pandemic to go at least and through the end of calendar year 2023. So we believe that based on this language that was published in the Federal Register, that the direct supervision through virtual presence will be allowed at least through the end of 2023. And again, we advise you to seek legal counsel, as you would always do in these matters, to make sure that state-by-state laws and regulations and policies and procedures are followed. Payment. what are we going to do? We're going to be patient. Now that you have all that documentation that you spent time detailing, the claim is going to be put through a review process and may not get paid as quickly as your other claims. It is reviewed one-on-one on a manual, generally on a manual basis for that individual patient. So if the decision is not in your favor, begin the appeals process. And we'll talk about that in a minute. But first, when you're getting the bill ready to submit, how much should you bill? Well, our company did a review of the Part B utilization for pain management. And in 2021, the mean charge was $1,492.30. And 62% of the claims submitted were allowed. So this is just a benchmark. It's something for you to start with. Again, you may have individual contracts with some of your health plans and payers. So that's what you want to use as a guideline as you begin your payment process. Appeals. What do you do when you have appeals? And I will tell you, I'm working with many clients. We have all sorts of paper. We like to send many pages of documentation when a claim has been denied or partially denied. And the first thing you need to do is to just read through that notice thoroughly, because the reason for that denial will be listed on the first or the second page, and it will most likely be in the situation of the BioWave pens for medical necessity that there is no benefit. So when you have an appeal, read the notice thoroughly to understand the reason for the denial or the partial denial. Most of the time, it's because of medical necessity or there is no benefit. And we generally receive a whole paper of documentations with these documents that come from the payer. And thing to do is read the document thoroughly and look in the first or the second page is normally where the reason for the denial or the rejection, whatever they're calling it. And primarily it's for medical necessity again. So you're going to go back through those documents that you carefully put together, and you're going to submit those along with whatever evidence the payer is requesting in their rejection notice. And they'll tell you whether they want clinical studies, whether they want protocols. They'll be very specific in terms of what is required. And it's generally the same thing. So you'll find as you have your paperwork ready for appeals that you are submitting the same documents, you are submitting the same clinical trial data that the BioWave pens has made available. So you can show the payer what is documented to support the medical necessity. Of course, you need to follow up. The timelines vary. Some payers will allow for 45 or up to 90 days to review this documentation. You may be required to have a peer-by-peer review of the documentation. So that would be a physician from the insurance company speaking to a physician that the BioWave pens group has made available for you to use in a peer-to-peer review. So in summary, the BioWave pens can be reimbursed with proper supporting documentation. Every health plan is different, so follow their policy and don't hesitate to appeal when necessary. We are here to assist you, and we have allowed additional time today for you to ask your questions. We find with reimbursement that many folks have specific questions that when we're doing a general presentation like this, we try to hit on all the variables, but there's always something that comes up that is unique and that someone would like to ask us about. So we've allowed additional time today for you to ask us your questions, and we are here now to take those questions and answers.
Deb, thank you so much. That was such a thorough coverage of BioWavePENS reimbursement. I appreciate your expertise. And my name is Anya Cornier. I'm Marketing Director at BioWave, and I will be opening the Q&A session. So if you have questions for Deb, please submit them into using the Q&A button below the screen. And we will start with the first question. Does Medicare or commercial insurance cover pens, BioWave pens?
So thank you, Anya. That is one of the most common questions that we receive. And here's the answer. So Medicare does not have a policy for pens coverage and payment. Medicare and other commercial plans, Blue Cross Blue Shield plans, et cetera, can pay on a local administrative contractor or case-by-case basis for the claims reported, as we've discussed, with using code 64999.
Thank you. And here's the second question. What are the best diagnosis codes to use?
So the BioWave pens can be used for any type of chronic, acute, or post-operative pain. And the most popular locations are the lower back, knees, ankles, and shoulders. And as we mentioned, BioWave does have a protocol for migraines and concussions.
That's important. Thank you. The third question: what treatments must be done prior to get approved for BioWave pens? This will be very interesting.
Yes, that's definitely an important question, and one we get quite often. And most adjusters or payers want to see what we call an incomplete trial of TENS or an inadequate response to TENS. And they want to know that the patient has tried and failed other conservative treatments, whatever they may be, physical therapy. Again, the most common, of course, because it is so close to the therapy, is the TENS.
Mm-hmm. Thank you. That makes sense. Do you have another question from a provider? Do you have sample node or LMN?
Yes, we showed you examples of those in this presentation, and we do have those documents that we can share with you. Remember, that's just a guideline, a template, and you do these LMNs, I'm sure, on a very regular basis. So customize it for this individual patient, for your practice. Noting everything that you have done, as we've discussed. This documentation, documentation is really the key. I hope we emphasize that enough, and that's what you want to put in the LMN. And if you have diagrams, use the pictures that we have, where you can notate the various parts of the body where you applied the BioWave TENS electrodes, so that you can show that this is very, very different treatment modality than TENS or any other therapy that you've been working on with this particular patient.
Thank you, Deb. I want to add for myself after the webinar, we will email all providers who registered for the webinar. And within that email, we can include the note, or you can request it from our team if you want some more specific information. And we have another question to you, Deb. So do you have EOBs?
We don't really have EOBs because we are not the payer. However, we have many practices who are repeat buyers of the electrodes and so forth, and that tells us that they are getting reimbursed. So again, we don't have samples of EOBs for that very reason, as we're not a payer. We don't actually bill any of the health plans. We don't bill Medicare. We just work with folks like you who are in the process of doing that billing.
That's right. Thank you.
Yeah. Yep.
And here is another question. How long is a treatment? Can anyone in the office perform the treatment? If you could elaborate on that.
Yes. Okay. So the first part of the question, how long is the treatment? Treatment is 30 minutes, right? And the unit will automatically shut off at the end of the 30 minutes. And as we've discussed, the patient controls their own comfort level by adjusting the intensity of the treatment by pressing the up and the down button. So that's the first part of the question. How long? 30 minutes. You don't have to think about, watching the timer. You can set the patient up and the timer will automatically go off in 30 minutes. You can go and, work with another patient who might be in the area, in the same room, so forth. And can anyone in the office perform? So we have the guidance document that Anya will share with all of you. State-by-state guidelines are very, very specific. So we want to make sure that you have consulted with your attorney and anyone who is helping you with whatever those guidelines might be, and to also make sure that those people have their credentials up to date, because we have seen in, not necessarily claim rejections, but certainly in audits that will come up if the particular individual does not have their credentials. So in some cases, again, as examples, it can be the MA, it can be a PT, it can be a chiropractor, as long as the required physician supervision is available. So we do have documentation to support all of that in general, but remember, each state has different guidelines for what each provider is able to do, and that's up to you to make sure that you have checked those parameters, and again, make sure that everyone is credentialed. So I hope that helps answer that question.
That's very important. Thank you, Deb.
Mm-hmm.
And we have last question here, which is very important and I'm sure interesting. Interested. Yes. So, how much can I bill per treatment?
So yeah, very, very good question. So as we mentioned in the webinar here, Medicare average around $1,400, $1,492, I think, and 30 cents. I said 32, but it's actually 30 cents. So that is the average that was billed for this code 64999 in the time frame from which we did this particular analysis. So that is, truly just a guideline. You need to work with your payer. Maybe you can discuss this with them up front, particularly if you are going to be treating a number of patients. You want to make sure that you have a nice policy with them. You can work with their provider relations rep and get a contract in place for that. If you are working in a particular area with a payer and you have many patients with that same payer, that saves you some time. It saves the provider time, because remember, these claims are all processed on a case-by-case manual basis, which means someone is looking at the paper and they are looking at all the documentation that you have submitted to make sure that what you have sent to them justifies and documents the treatment and the therapy. So I hope that answers your question.
Yes, that was very thorough. Thank you.
Yeah.
Thank you, Deb. And I'm checking the Q&A section. We have no questions. And I think you've covered a lot, Deb. Thank you so much. Thank you all for participating today in our webinar. We will be sending an email with a link to the recorded session. So if you were not able, someone else wasn't able to participate today, you will be able to watch it. And we will include the documents that Deb mentioned. So thank you. And please look for our next webinar in a month. We will be having a new guest with a new, very interesting topic. Keep you posted. And Deb, thank you so much again for your wealth of knowledge and expertise on BioWavePENS guide. Thank you.
My pleasure. Thank you, everyone. And please do reach out to it. As we said, we are available to help and assist you with questions as you read through the material. And you may have some particular individual circumstances that are unique. So don't hesitate to reach out. We are available to assist you. And that information will be provided in the documentation that Anya sends to you.